Good day, everyone. I'm Myrna Doumit. I'm the immediate past president of the Order of Nurses. I'm a nursing faculty. I'm a researcher. I'm a Lebanese nurse and proud to be.
Hello, and welcome to A Seat at the Table, the CAST podcast on women's empowerment across the Middle East. Today, we are honored to have our guests, Dr. Myrna Doumit and Madam Mona Ghanem. To start us off, Dr. Myrna Doumit would like to say a word to the healthcare professionals in Lebanon.
Thank you, Lara, and thank you for giving us the opportunity to be at the table. I will take this opportunity to salute our Lebanese nurses. I would like to tell them hats off to you because you proved to be not only heroes but superheroes, and you continue to be like this. You are working under very difficult situations, health, economic, and you are still at the front line defending the Lebanese healthcare system. Thank you very much for all what you are doing, and hopefully the table or the decision at the table will be helping you to continue your mission in Lebanon.
ثانك يو دكتور. نحن كمان بنضم صوتنا لصوتك، ونحن كمان بنقول لهم هاتس اوف على كل شيء عم تعملوه من اجلنا ومن اجل الانسان بشكل عام. وكمان معنا نحن من الدنمارك مدام غانم يلي رح تكون عم تحكينا شوي عن التحديات نوعا ما على مستوى السياسات العامة اللي عم تواجهها المرأة تحديدا بمكافحتها او بمواجهتها للجائحة يلي صرنا من 2019 عم نواجهها كبشرية.
Okay, thank you very much for including me in this very important event topic about COVID and women is very essential and very important. We know that COVID has different and multiple consequences on the public life and the private life. And if we talk about private life, we know that women has to stay at home, and children and fathers and husband has to stay at home, and this has increased the domestic work burden on women, and make her time much less than before, or put a lot of pressure on the woman to take care of the children, to take care of the husband who is there, and also this has increased a lot of violence against women, as we know, across the world. Also, women were prevented from movement, and this has a lot of implication on the very poor group of women who has to go out and work on daily wages. So this is through the COVID has thrown a good percentage of women in the poverty. In some countries in Europe, for example, where they have applied the telemedicine to get services, this was not applicable in other countries in the Middle East, where women also where the COVID has prevented them from accessing to health services. And this has become very critical when it comes to reproductive health and maternal health. So we can see that there is a lot of implication on the women in the private life and also in the public life, where the women politicians were not allowed to go and see their people, were not allowed to organize for their campaign. And finally, and the most important aspect, that women in the health sectors, the workers, and we know that 7 out of 10 health workers are women, were the one who are defending us, defending humanity, as you stated, and working to compete with COVID in the hospitals, in the clinics. So they were not only exhausted by the amount of the work, but also they were at risk. I mean, personally, and this has created a lot of dilemmas and a lot of pressure on the women, because they were also scared that they will infect their families, and they will carry the infection to their houses, to their children. So So there, I mean, talking about COVID and women is a very, very important, and it has a lot of aspects.
Yeah. I mean, what I hear you say when you say that is that, yes, 7 out of 10 healthcare providers are women. And in addition to that burden of having to face the pandemic literally on the front lines and putting their lives at risk, in addition to that, there is the role of gender roles that we understand and that we know. And so in addition to having that, they have to take care of their families, they have to protect their families. So they're carrying more than one burden at the same time.
Yeah, I mean, takes me to talk about the care work and how it is undervalued in the system and in the economy, and how people don't look at the unpaid care work with significant importance in the economic life and the society life. I think with the COVID-19, we should really rethink about the unpaid care work and the paid care work, and how while it is the most important work in the society and in the economy. Economists and governments tend not to pay enough attention to this kind of work, and when the women go out, they still suffer from gender segregation in the markets. Like when we say care work for women and care work, even in the countries which is considered to be more advanced than Middle East in the gender aspects, they still have this stereotyping of the care work and consider it only a woman domain. And I would like to give another examples. Even the health sectors, women are not represented in the highly paid health services like medical specialization, because societies tend to stereotype even the medical specialization like neurosurgery or advanced surgery, where even the USA and Europe, men are underrepresented in this high specialization. So now with COVID-19, it's an important historical moment to rethink about the gender in the health sectors and gender and care work and the importance of the care work. And there is a lot of work has been done on the differences between neoliberal economy and how we can move from neoliberal, which is based on the selfishness and competition, to the economy care, which is based on loving and caring and giving more attention to the other people with enough attention. Thank you.
Yes. maybe هون فينا نسمع رأي دكتور غانم على هذا الموضوع من ناحية اللي كنت عم تخبرينا إياه عن your success stories بهذا المجال وتحديدا بدعم women on the front line بعد COVID.
Yes. But what I would like to say is that we cannot take COVID as an example, COVID-19, because COVID-19 did not differentiate between genders. Men and women were equally affected. The whole humanity was affected by COVID-19. But yes, for example, if I want to take the example of female nurses, maybe they had more responsibilities because on top of their work at the hospital, taking care of COVID patients, they also needed badly to go back home to take care of their families. And here they were living like a dilemma that are we taking with us the virus home? Should we stay at the hospital? Who's gonna take care of our families? This is true. But also we have the male nurses who have other responsibilities also for their families. So this is why in nursing we don't look at gender per se. Mm-hmm. We look at the person as a human being, yes, regardless of the gender. But if you're asking me the question, are women taking their true position in the society at the decision-making table? I say, at least in my country, in Lebanon, no, we're not taking our true position at the decision-making table. This is why when I took office in 2018 as president of the Order of Nurses, my agenda consisted of 2 pillars: politics in nursing and media and nursing, and my logo was to put nursing at the decision-making table. And to do this, I had to really use several strategies. And many times, many meetings, we were not invited. I used to invite myself, and I used to bring my chair to the meeting. And I used to, and if I knew of the meeting afterhand, I used to call and say, I wish I was invited, and I would like to be invited next time. So we have to have this perseverance. We have to have this courage, we as women, to impose ourselves, and not only to be at the table, but we have to bring meat to the table. So we have to come prepared, we have to use the power of knowledge, and this is exactly what we do. And our way of doing this is, my way was to use media. So I used media, and I created coalitions with people who are influential, regardless of their gender, so that we can advance the nursing agenda at the table. Nursing is mainly, we are like 21% in Lebanon males, and the other percentage females. So majority we are females. And so far we had only one president who was male, the founding president of the order, but the subsequent presidents, we are females. Of course, our nurses in hospitals, they are suffering from not being at the decision-making table, even if we have nursing directors, but unfortunately, they are not all decision makers. But this also maybe depends on the education. We have to look at education. It has to be looked at contextually. So we have to look at the education, we have to look at the culture, we have to look at nursing curricula. Are we preparing leaders? So not only nursing curricula, we have to look at all curricula in all universities, whether in business, political science, engineering, medicine. Are we preparing people who are content-based excellent, or are we preparing good citizens? Are we preparing leaders? So maybe we need to look back at what we are offering to our youth. And of course, when we prepare leaders, this does not mean that we want to exclude man. We want the man, I mean man, M-A-N, to be our partners. We want to work. To succeed, you need two hands. And we need to work hand by hand, and we need to reach together the decision-making table, because it's very well known that men think differently than female, than women. So if we are both together, thinking together, I'm sure we're going to have better solutions, and we're going to have a better world.
Dr. Doumit, I think this is a beautiful insert to learn a little bit more about your role at LAU and what you've done there in the School of Nursing. For those of you who are listening, it would be great to get some context on that, and how in your role you've taken this lens of using education as a way to create leaders in the industry.
Yes, thank you for opening this topic. I'm the founding assistant dean of the School of Nursing at LAU that was started in 2010. And before that, I was an AUB faculty for 20 years. Then I was recruited to start the School of Nursing, and we started a state-of-the-art School of Nursing. The curriculum is different, but what is unique in this curriculum is that we included politics in nursing. So we have in the leadership course, we have a topic called politics in nursing, and the importance of looking at politics for nurses, how to deal with politics.
Just to interrupt you here quickly, you said that as part of the curriculum you have a leadership course.
Yes.
So that already sounds like it's something really interesting, and maybe you could tell us a little bit more about that.
Yeah, of course, because in nursing, our aim is to graduate leaders, beginning leaders, because leadership has
A
different
journey.
steps. So it's a journey. Yes, you are right. So we're starting beginning leaders. So we give them the basic concepts of leadership. What does it entail? Like communication, like delegation, like teamwork, how to form a team, and all the other topic, and including, we're innovative, we included politics in nursing and the importance of tackling this topic, why nurses need to be introduced into politics very on. Also, we have, before the pandemic, since 2011, we have a topic called emergency preparedness and disaster planning, part of the leadership course. So we were innovative in our approach, and we included all these topics for our students. So I think we're an accredited program. We're accredited from the United States by the Commission Collegiate of Nursing Education, which is the highest level of accreditation for nursing schools. And they don't mandate this emergency preparedness or politics, but now, after the pandemic, they started to say in the revision of the accreditation that you need to include this, but we already had it. So it's very important, regardless of the major. We have to introduce our young people, male and female, into politics, the true politics, and not the politics that they see on television, not the politics that we don't like. Politics does not mean lying. Politics does not mean stealing. But this is the impression that at least our youth in Lebanon have about politics. We need to change this stigma. And politics is an art of communicating, art of sending messages, art of creating teamwork, art of creating good citizens, the art of creating a good country for all. So this is politics. And if you want to reach your aims, for example, as president of the order, I was entrusted to put the order at the decision-making table. So I had to play the political game. For example, create coalitions with strong people, have good communication, use the media, hit the nail when it's hot, put short-term, long-term plans, follow up, develop the nurses, develop the team. So I was working on different levels, and of course this needs time. My term was for 3 years. 3 years are a short period of time because Rome was not built in one day. So change needs time, and we need to continue with the same approach so that we later on be able to introduce the idea of that, yes, you are capable to be a leader, because leadership is responsibility, and not everyone would like to be in that position.
انطلاقا من عم تقولي، انا عندي سؤال لمدام غانم على موضوع، يعني اذا عم نحكي نحن مثل ما عم تفضلت وحكيت دكتور دومت، انه التغيير الحقيقي يتطلب قادة، وقادة يعني من الاجيال القادمة، من الاجيال اللي عم تكون من خلال المناهج التربوية، ولا سيما بالبرامج التربوية اللي تعنى بموضوع الهيلث كير، عم تتدرب وعم تتحضر لموضوع انها تاخذ كمان مثل ما قال الدكتور دومت، تاخذ الكرسي تبعيتها وتحضرها معها على الطاولة. سؤالي لك هو كيف هيدا الدور اللي عم نعمل على مستوى النقابات المحلية نقدر نحوله تيصير عمل على مستوى الجمعيات الدولية، والعمل على مستوى السياسات العامة يلي من خلال خبرتك بهالمجال عم نقدر نحن نطلعها إن كان بسوريا وإن كان بالعالم العربي.
Okay. Talking about leadership is very important, especially when it comes to the Arab region. And for the leadership to grow or to appear, we need a free political environment. And I think this is essential in our struggle for democracy in the Arab region. So yes, I agree that politics is not lying, it's not stealing, but this is lack of politics which turn people into stealing and lying and into also violence, because politics in the Arab region or in the Middle East in particular is very much linked to violence, and people understand that when you do politics you have to be subject to violence. And women in particular, when they get into politics, they think that it's okay to be violated, it's okay to be mentioned in the bad words, because this is the price we have to pay for our political participation. So I think all in all, when we talk about women participation, youth participation, it's a democratic struggle. It's a fight for democracy, where everybody can sit on the table and have the opportunity on the sitting on the table, not because they have the family support, not because my husband or my friend or my family connection. It become the right of everybody to sit in the table. And I want to go back a little bit about the COVID, because COVID also was an equity sensitive. I mean, COVID has deepened the inequity across the world, including the gender inequity. And in this sense, I would like to say, talking about health sector, that 68% of the victims of the health workers who were infected by the COVID were women. So when we talk about leadership, we need to talk about equity. We need to talk about democracy. I mean, training some people will give chance for only minorities to get like us. Like we were lucky that we were able to cross the line and to be active and to do political, but we are minorities and we have paid high prices. In the Arab region, women pay high prices to be leaders. And I debate that now. It's in the Arab region, since 2000 or even before, we have this system of the first lady, where women needs to be in the group of the first lady to be able to be politically active. And this is also something we have to look into it very, 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 very carefully, because women are not allowed to create their women movement. I would say, this is an example in maybe in Syria, maybe in Egypt, maybe in Lebanon to lesser extent. I don't see it very much in Lebanon, because Lebanon is a different case. But also we have to look into the role of the political regime which is controlling the countries. I mean, democracy is the ultimate goal, but it's the road also to have leadership, people who has leadership, and people who has equity and equality in their life. I mean, these things I cannot differentiate, I cannot apart them from each other. And gender equity, I think it's essential here, because I mean, we don't need women to be on the table just because we are feminists. I consider myself feminist, but it's not the only reason, because I want women to be there, because women need to be there. Because women on the table, women in decision maker, is a condition to achieving sustainable human development, which is in the best interest for men and women. And also in country like Syria, where we have lost a great number of our men, the women participation in economy and politics and education in all aspects of life is essential to build a new Syria, hopefully very soon.
So what is the role of the international community in supporting such movement?
Okay, international community, they tend to support only the surface. Like they say, we want to empower women, but they don't support democratic changes, okay? So, I mean, we have to lobby and advocate for the necessity of democratic changes and political life and political freedom in the Arab region. Otherwise, what we are doing is only cosmetic changes. And most of the people who become empowered, they will leave the Arab region and go to Europe or the USA. So it's not, I mean, we need to tackle the roots of the problem. And the root of the problem that we don't have democracy, we don't have rule of law, we don't have equity, we don't have equality. So, I mean, we need to couple the lobbying for leadership and women political participation with the struggle for democracy and needs for a deep-rooted political change in the Arab region.
I think this is a beautiful transition also to go back to Dr. Doumit's personal experience, fighting literally to bring nursing to the front lines, to bring it to the decision-making table, and to hear from you what that was like. What stereotypes did you have to take apart? I mean, what spirit do you have to go in there and change the system and pick up the phone and call people who might be a little surprised to receive the phone call?
Yeah. Before I tackle this point, I would like to add to what our colleague was saying. And I agree with her that change is needed. But we have to all understand that no one would tell us, come on, I will put you on the table. So we have to have our own fight, which means change. And we all know that change is painful. And change, just to answer, Hamad, your question, what international organization can do. International organization cannot have a magic stick. They have to do something that is contextual. Here we go back to academia, we go back to school, we go back to universities, we go back to curricula. When you put this idea in the mind of people, of young children, men and women, since they start school or when they reach university, they will end up by being citizens, believing in each other. But when you are living in a culture where women have their second role, or they are not respected, or they don't have a say at home, this person who might become a leader would behave the same thing. So in the medical or health field, we have something that is not new for nursing, but new for other fields. It's called interprofessional education. And the aim of we call it IPE. The aim of IPE is to really help nurses, physicians, pharmacists, social workers, you name it, to work together when they graduate. But if they don't study together, if they don't mingle together, if they don't deal with cases together while studying, while they are students, they will not be able to do it later on when they graduate. Okay? The same for leadership. It has to be started early on, so when men and women graduate, they have their mindset prepared to accept each other and not to look at gender as a barrier. To go back to your question, it wasn't easy at all. Many people were surprised that I used to call them and say, I would like to be invited to the meeting, or I heard that you're going to have a meeting tomorrow and I would like to be invited. But you know that the 80-20 rule, communication is all about what you say. It's 20%.
So for those of you who are listening, the 80-20 rule basically says that 20% of your actions will result in 80% of the results that you want.
Exactly. So in communication, the 80-20 rule is that communication is what you want to say, but the 80% is how you say it. So there is a way of communicating. So it's true that you see that I'm very perseverant, I have a mindset, but there is a way of telling this to people that will help them to accept your ideas. And also you have to play the game by creating coalitions. So I looked around and I tried to pinpoint the strong orders in Lebanon, those who are influential. And I went to them and I said, look, it's a win-win situation and would like to work together. And now they are talking about medicine and nursing, law and nursing, media and nursing. So, and again, we have an important weapon, which is media. You have to know how to use media. It's a very important weapon that might turn against you, but if you know how to use it, it can help you a lot.
For those of you, for all of us actually, who are learning from the powerhouse here, can you tell us a little bit more about this 80%? What does it mean to communicate effectively? Because essentially what we want to do is empower the people who are listening to make use of what you know.
So how to say it? You have to use simple terms. You have to use people's language. You should not use complicated terms that people do not understand. And you have to be really close to people. So it's not, again, I say it's the know-how to make people understand your idea. And I received this feedback from many people who were listening to what I was saying on the media regarding COVID. And truly, they were telling me, you know, when you speak, we understand what you're talking. And because I try always to simplify things. I like to use the way, like storytelling for people so that they can really link it to something that is close to them, something that is part of their daily living. And by going to media, I was presenting myself as a nurse and proud to be a nurse. So people started to hear nursing, nursing, nursing from the media. And my plan was also to have the support of the people of Lebanon. And I asked for the support of the people of Lebanon. I told them, our nursing workforce is in danger. And without nurses, you don't have healthcare. So we want you to support us. And the army, the internal security, they saluted nurses for the great job that they did during COVID.
And for those listeners who are not necessarily that familiar with the Lebanese context, Lebanon was faced with three major threats. I mean, not threats, three major catastrophes. One of them is the Beirut port explosion. The second is the collapsing economy, which had a major effect on the availability of goods and medicine for nurses and doctors. And finally, the pandemic. And so I think it would also be really interesting to hear how you were able to steer.
You know, Lara, I always, I said it and I always say it. I wish we were only dealing with COVID in Lebanon. It would have been a piece of cake. This virus is one of the simplest viruses that we deal with as nurses. We have much more important viruses that we deal with. And just to let you know that as Order of Nurses, we started training of nurses before we had the first case, because we were observing what was happening in China, and with globalization, we knew that it's gonna come. So we started the training with the help of WHO Beirut office. And so it wasn't a surprise. We were waiting for the virus to come. But the circumstances that came with the COVID were the most difficult. The financial collapse, it's a complete collapse. Our nurses in some hospitals were working without PPEs, and I had to raise the voice. Nurses were asked to use face masks, not the surgical ones, made of fabric. So, and I had to use the power of science, bring research to say, no, this is a danger.
And for those of you listening, PPEs is protective personal equipment,
yes,
correct?
protective personal equipment like face masks, like gowns, like
this insulating
yes, gowns,
vest.
like gloves, and also some hospitals were giving only 2 gloves per 12 hours for each nurse, and this is not enough. So we were working and still working under very difficult situation, not to say that the pay scale was very low. Then we had this Beirut blast. Beirut blast, we lost 5 of our young nurses while on duty. They were sloughed by glass or crashed by a door. And the nurses, they saw their colleagues dead on the floor, yet they were themselves injured, yet they had patients in front of them that they had to salvage. Many of the nurses, while injured, they carried patients on their back from the 9th floor to the entrance of the hospital because there were no electricity and no elevators. Women were in the delivery suite and nurses had to hold them with the baby or while delivery and move them to another hospital. At the same time, no one knew where the explosion was. So the citizens of Beirut were running to the big hospitals because the hospitals that were completely demolished were big hospitals in our capital. So people were running to seek care at those hospitals. They used to reach the hospital and they found no hospital. So nurses and physicians were treating patients on the street with no lights under the with the
torches
with their with the light of their cellulars. August 5, we declared it as a national strike for nurses. We were striking. We planned for a national strike except for emergency cases because we wanted our right. And we were about to close all hospitals, north to south, Bekaa to Beirut. And then August 4, 6:07, we had this explosion. Within 5 minutes, we had a Zoom meeting and we stopped all our activities and we called on all nurses to go to their hospitals. Mind you, some nurses were 1 week ago fired from hospitals. They run to those hospitals to help.
Because of the economic situation?
Yes, because of the said economic situation, because I don't believe that hospitals were struggling or are still struggling, because this is a second topic that we can talk about, another topic. But nurses were fired and still they run to their hospitals to help. Nurses in the suburb, they called me, what can we do? Do you need us? I said, we don't need you. Stay in your hospitals because we're gonna send patients to you. In fact, patients were sent to the north, to the south, and nurses who were not able to reach, they donated blood. So nurses really, this is why I call them not heroes, but superheroes. They were, and you can all look at YouTube. We have made a film of this just to keep it for record, for memory. YouTube, Order of Nurses, August 4. And you can listen to the heroic action that our Lebanese nurses did to salvage. Mind you, the age is between 21, 22, 25. And usually when you are faced with such situation, the first thing, your instinct would tell you, run away, run away. They did not run away. They stayed and fought for the life of the Lebanese citizens.
Lebanese residents.
Lebanese residents or residents and citizens and Lebanese people or people living in Lebanon because we had all nationalities that were affected.
Exactly.
And they stayed on duty for like 48, 36 hours. And what we did in August 4 really was أنا بقول عمل بطولي, because it's not easy to deal with like 6,000 injured people, more than 2,000 200 deaths, and to encompass all this and to control all this within 24 to 48 hours. So again, here hospitals did a big job. Nurses, physicians, health workers, hospitals opened their door and accepted all patients. So, but it wasn't easy on us. And what made me continue, I was on the ground all the time. What made me continue was the idea of that we lost 5 nurses. I made it to their soul. And I wanted to do something for them. And I wanted to do something for the nurses who remained in Lebanon, nurses who were injured. So I put an international call, and I was able to do an international fundraising. I got fresh dollar, and I gave all nurses who presented their paper, we have put a call at the order to present all their papers, like pictures of what they lost, their injuries, and we paid them in dollar. Of course, we could not pay everything, but we were able to support them a little bit. So it wasn't easy. We then, within 40 days, we did like a commemoration for the nurses, and it wasn't easy to see their parents, to see their pictures. Our young ladies, some left, one of them left a baby, a child, the other left a husband, the other was just a young graduate, her mother, father, sister. So we had like, it was a disaster. It wasn't easy on me, but I promised them that we will continue. And still, we need to know the truth. We need to know why this happened. Why did we lose our young nurses? Why did we lose our capital? Why this happened? We don't want to blame, but it's our right to know the truth.
Madam Mona? Madam Mona.
نعم.
ببلداننا العربية لأسباب كثيرة عم نخسر كثير من هالسوبر هيروز اللي عم بيكونوا على الخطوط الأمامية. شو بتوجهي اليوم رسالة لصبايا خريجين بدهم يفوتوا بهالقطاع الطبي بلبنان وبالدول العربية؟ شو بتعطيهم نصيحة؟
أهم نصيحة ممكن الواحد يحكيها بالنسبة للناس بدها تدرس القطاع الصحي، إنه هذا أهم قطاع صحي وأنبل قطاع صحي وأنبل قطاع ممكن يشتغل فيه الإنسان بالمطلق، لأنه الصحة هي أهم شيء موجود لدى الإنسان. الشيء الثاني إنه نحن منطقتنا ما كتير بتهتم بالبحث العلمي، فأنا بعتقد إنه تنمية مهارات البحث كتير مهمة. يعني هي القصة دراسة الطب أو دراسة العلوم الطبية كلها مش مقتصرة على المنهج هو مجرد يعني مثل ما بيقولوا ضوء. الاهتمام بالبحث العلمي هو شيء كتير أساسي وكتير مهم. الشيء الثالث اللي بدي أحكيه إنه للأسف قيمة الإنسان موجودة بالمنطقة العربية ما كتير عالية مقارنة بقيمة الإنسان في مناطق مختلفة من العالم. خلونا من خلال القطاع الصحي إنه نحن نرفع قيمة الإنسان، نهتم بالصحة بشكل كتير كبير، وهذا بيتطلب عمل على المستوى السياسي. نحن بحاجة إلى إعادة هيكلة النظم الصحية في بلدنا، رغم إنه بعض الدول العربية اهتمت بمنهج الصحة العامة بعد مؤتمر المآتة وقررت إنه تعمل نظام صحة جديد بالمنطقة، لكن نحن لساتنا بنعتبر إنه الصحة هي حكر على الأغنياء اللي بيقدروا يفوتوا على المراكز الصحية الطبية المتخصصة. وكمان في عندنا فكرة كتير أساسية إنه نحن في استغلال من بعض الجهات الطبية بدنا تاخذ المريض مباشرة إلى الادفانس تكنولوجي، مش إنه نحن نمشي تدريجيا. بدي أذكر إنه وقت كان في طبيب العيلة سواء ببيروت بلبنان أو بسوريا، كان الطبيب مش بس هو طبيب للعيلة، بس هو كان كمان هو حكيم العيلة، يعني كان هذا الطبيب كان هو الحكيم. وفي الزمان القديم كان الطبيب هو حكيم وفيلسوف وسياسي. فنحن بحاجة إلى أنه نرجع نعيد النظر بدور الطب في المجتمعات العربية، بدور الصحة بالمجتمعات العربية، وأهم شيء وهي رسالتي لكل الناس، أنه نضل عم نناضل لنحافظ على قيمتنا كبشر، مش نحن كوقود لانفجار ما بنعرف وين صار، ولا لحرب ما بنعرف ليش صارت بالمنطقة. فهي كتير شيء كتير مهم. بحب أكد على آخر نقطة اللي هي قلتها بس بدي أكد عليها، إنه الطب ليس فقط علاج، الطب هو سياسة. فنحن بدنا نركز كثير على علاقة النظم الصحية بالنظم العامة بالنظم الاجتماعية الموجودة بالبلد اللي احنا عايشين فيه.
Thank you so much for joining us today for a moving and difficult and impactful conversation where we explore not only the importance of women in the healthcare center, but also the necessary connections between healthcare, politics, and media. And most importantly, I think the takeaway is to be internally motivated and internally courageous enough to make the step to see the change that we want to see.
ومرة أخيرة hats off.
Hats off. Thank you.
Thank you so much.
Thank you.